Hi everybody and welcome back to my vlog. And once again, as you can see, I'm somewhere else, different surroundings, and I'm doing another collaboration, which is something that's been working really well. And today I'm with the lovely Jamie Dowling, and I'll just tell you briefly how we met, and then she can tell you about all of the wonderful stuff that she does. So you'll know, because you watch me, that I did a BBC Inside Out piece on the menopause and why women are not getting the treatment that they need on the NHS back in February. I can't believe it was that long ago already. And Jane was one of the women that you'll see in the interviews telling us about her story. And she kind of comes at menopause from a slightly different perspective to other people quite often. And I think it's really interesting. And so I'm actually working with Jane on some projects, one in particular in the future. And so I thought it would be a great day for us to say hello together, for Jane to tell you about what she does, and then for us to tell you about the event that you might want to come to in September. So, handing over to Jane. Jane.
Thank you very much,
Welcome to my vlog.
Thank you for having me. Right, okay, so where shall I start? I'll start from 25 years ago. I've been in the health and fitness industry for 25 years, so I've always been really active. I was a gymnast, and then when I started my career, I taught multiple classes, loved it. And then fast forward a few years, I sit by a car. So it was quite life-changing. However, I always try and see the positive in life, and that's why I opened my studio here in London Bridge, because I wanted to carry on teaching and carry on doing what I loved, but I was in severe pain. And so it was quite a life-changing thing for me, and because of many different factors and because of the car accident, I had 2 shoulder operations. During that time, it sort of accelerated through the years, and as you know, as you get to a certain age, you might have teenagers and parents that you're looking after, so we're kind of the sandwich generation. And I was getting really stressed. And I stopped one day when I had a panic attack in here, and I had to take stock, and it's then when I went to my doctor, and he did some blood tests and said to me, "You're menopausal." I thought, I'm 46.
I was going to say, how old were you?
I was 46, I'm now 52.
So 46 is probably every 46-year-old woman is in a degree of perimenopause.
Yeah.
They may not realise it, but they probably are.
I didn't. No. And looking back, I probably had a lot. I was in perimenopause for many years, but I was on the pill, and you know, a lot of GPs just don't understand the menopause. But I had to stop and really take stock, because I had my first panic attack. I was in severe pain, joint pain, and my GP said, well, it's because you was a gymnast, you was an aerobic instructor, and I didn't realise it was because of the decrease in estrogen and it affects the collagen in your joints.
So panic attacks are hideous, and we quite often as doctors see people call 999 when they're having a panic attack because they think they're going to die. They think they're having a heart attack. I think that anxiety and panic is one of the first symptoms of menopause, perimenopause, for many women, and probably the one that goes undiagnosed and/or untreated. And I think the most important question, and this is the question that GPs often don't ask enough, is up until that point, had you been someone that had anxiety or panic, or had you lived a life free of real anxiety? I mean, we all get anxious sometimes, but...
Yeah, I mean, I've had a lot of stress in my life. The last 20 years have been very stressful, so I've got a kind of a toolbox that I use, and it was a real wake-up call, and I was thinking about giving up my studio, giving up my career, and actually I love my husband, but thinking about working with him, and that's when it was like, okay. But I assessed my situation, and I thought, because of all of my injuries, I wasn't actually as physically active as I had been throughout my life.
Okay.
So it identified me. I really had to look at my lifestyle and what I was doing and why it led me to being in the studio. So when I was in the studio, I have a client, I've got the clock. In the session with the client, it was fine. When I could see the session end, I could feel my anxiety, because it was like dealing with real life. And so I had to really have a think about what was affecting me. And it was lifestyle and physical activity was a really big thing for me. Even though I was teaching sessions, because of my injuries,
Well, so I was just going to explain to the viewers just a little bit more background. You have always run keep fit, that kind of thing, sessions. That's what you did for a career.
That's it. And I was always physically active until my accident and my operations. And then I started to do some research into menopause and physical activity, and then just go back to the drawing board and really go back to my books and treated myself like a client. Like, come on, and picked myself off the floor and just took tiny steps, rehab my injuries. But then I started to think of the bigger picture, and a lot of my clients, I won't say we grew up together in this studio, because I've had it 13 years, and we was all changing, going through the change. And it wasn't until one day one of my clients was in, and she just burst into tears. And I just thought, oh. And it dawned on me that she was menopausal. And I just started to look outside the box, and I started my blog about 3.5 years ago. And at the time, we're lucky now, there's some good information out there. There wasn't a lot of information, positive information. So I started my blog, and it was a kind of lifestyle blog.
And this is the Meno and Me.
Meno and Me, yeah, so Meno and Me.
Menoandme.com.
Thank you.
You can find that.
And then a year and a half ago, Women in Sport contacted me. Because also what I've done in my career, I used to work with cardiac patients, and I used to work on something called the Falls Prevention Programme, that's FALLS, Falls Prevention Programme.
Going to interrupt you there.
Yeah.
This is because people that are watching, breaking a hip is the most devastating injury that anyone at any age can have, and people don't appreciate that. You hear about old people breaking hips. Well, actually it's not so old quite often. Women into their 50s and 60s who have got bone reduction in their density, so they've got osteopenia or osteoporosis, break hips with a simple fall. And just to give you some facts, not trying to scare you, 1/3 of those women, whatever their level of activity was before, will be dead at a year. Dead. And another 1/3 of them will never live independently again. And that's really important, because there are lots of ways of avoiding osteoporosis and of avoiding those kind of fractures. So that's really important.
Very important. And when I worked on the Falls Prevention Programme, we did simple evidence-based exercise. I used to work with a doctor called Dr Skelton. She's Professor of Ageing in Edinburgh University, and she was the one that come up with this. So it's all evidence-based exercise. So I had these women that were very vulnerable and having falls. It was awful. And when I'll just tell a quick story. When we called it backward chaining. So what we would do, we'd get these older people, older ladies, and we would say to them, like, in 6 weeks, you're going to be on the floor. Horror on their faces. But if you have shoulder problems, knee problems, they don't lift up, they don't go down. So if they have a fall, they've not been on the floor for years and years and years. So it's teaching them to manage. But it's a massive project, and these women were so severely affected. They call osteoporosis the silent killer.
Yes.
And it is, I have seen the other end of it. Now, when we hit menopause, our bone density decreases at a massive, massive rate, and you don't know you have it.
So this is why I call osteoporosis and heart disease and memory loss the hidden symptoms of menopause. Because even if you're sailing through it and you're not having any other problems, those things are still going on behind the scenes. So they're just quietly happening, and what you don't want to do is get to a stage where, oh, suddenly you've got a diagnosis of heart disease or osteoporosis, and there are things that you can do to stop that. And fitness is one of them for both of those things.
Also, going back to the heart disease, when I taught the cardiac classes, there were a high percentage of women in those classes. Yeah. And teaching cardiac classes was one of the, I used to do it with my husband. It was amazing, because when they came to us, they'd had a second chance. So they grabbed hold of life with both hands. And we used to do a lot of social events. It was a pleasure to teach. They were really funny. But I know if they could take preventative measures, they would. Yeah, absolutely. So at 50 is when internally things start going wrong, and I don't know the statistics, but at 60, that's when a high percentage of women are on multiple medication for osteoporosis, for heart disease. You might just start off on some statins because of high cholesterol, and some beta blockers to manage symptoms and high blood pressure.
So women only develop their heart disease, really, obviously there are some exceptions, as there always are, once they go through menopause. So once they lose estrogen, that's when their heart disease, and then it becomes the second biggest killer of women in the UK. Yeah. So it becomes almost as important as it is for men. There's not much in it now. So heart disease is really important and preventing it. But then also, as Jane says, your bone density is at its peak when you're 21. There's no denying that. 21 is the golden age, but you know nothing about life, so the youth is wasted on the young. But then as we go through life, that bone density goes down gradually, probably about 1% a year at max. If you breastfeed, pregnancy and breastfeeding helps it along its way a little bit, but a lot of that can be got back. But once you go through menopause, there is a dramatic increase in how quickly your bone starts to thin. So you can do things along the way, because what you start with is actually really important in terms of where you end, but also you can do things when you get there to change it.
Yeah, it's never too late. And also, so my passion is when I work with different clients, especially menopausal women, is I covertly give them stuff, and we talk about aesthetics, and that's really important because we want to be the best version of ourselves we can be. But it's also about internally what's going on. So hip, wrist and spine are the major sites for osteoporosis. So when I work with women, I try and get them as breathless as possible, have fun, and work on bone strength. Now, inadvertently, when you're working on bone strength, the muscles become stronger.
Of course.
And if somebody feels stronger and fitter, healthy body, healthy mind. So Women in Sport released a study, and it showed that women that undertook physical activity felt empowered and in control of their menopause symptoms. So I did a shout out because they allowed me to share the research before it was released, and I did a shout out on my social media. If you're a menopausal woman and you feel happy and in control and feel empowered in your menopause symptoms, I want to know about it. So I had so many women contact me. And so I use a lot of, they're on the site and you can have a look at them, they're lovely women. And I use a lot of these examples and when I give talks, etc. And one of the ladies, Jo Mosley, Happy Healthy 50, or it could be Healthy Happy 50, I'm so sorry Jo, I get it mixed up. But she had a lot to deal with when she hit menopause. And she's such an inspiration because she shows that being active, just really, and also being active outside. Research shows if you exercise outside, it's better for the mental health compared to
Well, it shows just being outside.
Yeah.
And not in your garden, funny enough, in a park, somewhere removed, actually has a lot. But we know that exercise, it ticks lots of different boxes. And that's the important thing, because all of these things get affected in menopause. Your bones, your heart, your mental health. Those are the three big pillars of menopause symptoms. And they take some women down. They leave their marriages, they leave their jobs, they isolate themselves socially. So we know that exercise addresses all of those things.
Yes, it does.
All three things get help from exercise.
And so it is, as we were talking earlier, your little gremlin saying, you don't want to do this, you want to sit down indoors in your PJs, you don't want to be going out. But if you put something in your diary, like the Couch to 5K, it's an app that, so I've set it that I've got, I think it's tomorrow evening I'm doing it. But if there's something in your diary, you're meeting people, and then you might just think, oh God, well, I don't want to let them down. Go out, put your comfies on, just some comfy shoes, and get out and walk with other people. It just makes a huge difference. And just 10 minutes, research shows, just 10 minutes walking outside lifts your mood, lifts your mental health. And also, if you're exercising, you've got these feel-good endorphins, your serotonin, your dopamine, that actually helps with so many other things. And I know myself, you're probably the same. If I don't exercise, I get a little bit, and not as productive. So I've been working on this program. I've been piloting it for the last about a year now, working on it. And I've been training up women like Jo and a few other women who have feel empowered in control of the menopause symptoms. And what I love about Me and our menopause community is, one, I've met some wonderful people like yourself, but two, we want to help each other because we want to break this taboo. And if I've met a woman that has taken control of their symptoms, right, how can we help other women? Because when you're feeling so down and so low, you just cannot see the wood for the trees, but I promise you there is a light at the end of the tunnel. So this program I've been working on is to get women together. So you have a leader, you meet in a park, you do some simple mobilities, it's going to help with pain, full joints and movement, then walking, simple, and then some evidence-based exercise on a park bench and with a simple diamond band. And if we do resistance work, hip, wrist and spine, it's going to help those bones. But also, covertly, if we work a muscle, you're going to like this, ladies, if we work a muscle and you've got a healthier, stronger muscle, it burns fat at rest. What I like to say to my ladies is, you've got your muscle, you've got little men in your muscles. When you go walking, some of these men wake up, they feed on your fat stores, go back to sleep. But if you do resistance work, simple resistance work and body work, some of these men stay awake and they feed on your fat stores at rest. And as we know, beating the belly fat can be more difficult during menopause.
Totally.
But it's, for me, and I'll go back to the study with women in sport, they looked into women of modern day Britain. We have 6 core values. Now those 6 core values change over our life. When we hit menopause, feeling good is number 1. And I know myself, I would have chopped my right arm off to feel good.
Because when you're feeling rubbish, you want the antidote, you want to go back to where you were, because you take it for granted. Through life, you take that kind of thing for granted. You take health for granted until you're not healthy anymore, and so on. So yes, of course, we want, and that's what we want. We want women to get back to feeling good, and we want them to do that in whatever way works for them.
Yeah.
So as always, not pushing any one treatment, and actually I think it's always a combination of lots of different ones that's individual to you. But I do think, and I agree entirely with Jane, that exercise and well-being is key. Because it doesn't just look after menopause.
Yeah,
it looks after you for a healthy older age.
It's not just about short-term health, it's about long-term health and disease prevention.
Yeah.
What Renee was talking about earlier about the statistics of heart disease and osteoporosis. It's how you can take control of your health now that's going to prevent you having a fall later down the line. I know it's like, God, I'm not that old person having a fall, but I've worked with so many women that all of a sudden they're in that category.
And 10 years ago, did you think you were that woman having menopause? No, you thought it was just, I don't know, over the rainbow, but not for you. But it is for all of us.
Yes, it affects us all and our families. And I know myself, and even my husband, I say to him sometimes, have you been out exercising at all? And he'll say the same to me, because it has a real direct effect on how not only I sleep, my mood, my concentration, and just feel good well-being. As I said before, those endorphins that are released, and if you can do it in a group, it's so much better.
Yes.
And it's just getting women together, and it's that support structure.
Yes.
And just obviously working heart and bone health, but you're out with other women, and it's mental health as well. So the program is totally free. I'm training up women for free, and the program is fun. And even if you think to yourself, oh gosh, I go out running, I do this, that's fine. It's getting together with people. But also I see this as a platform of women that want to get active, and Women in Sport said that the studies showed there's a thirst for women. When they hit menopause, they're a little bit unsure of what to do. So it's reassuring them that this is really quite simple, just we can put one foot in front of the other, and that's just to start. Everybody has to start somewhere. So if menopausal women have never exercised before, it doesn't matter. Or even like myself, I had exercised, but not for a long time.
Yeah.
It
comes back quickly as well.
Yeah.
Muscle memory is really quite amazing. And also we know that walking, just briskly, so it makes you a little bit out of breath, does wonders for your blood pressure. And the drop in blood pressure happens quickly, and it's quite dramatic. A lot of people can come off their blood pressure medication if they take to a 15-minute brisk walk every day. And I mean, who wants to be on medication if you don't have to be? So it's really, really important in so many ways. I've just done an article actually, or contributed massively to an article for cycling, about women in menopause and exercise, and it was for Cycling magazine. So I'll post a link to that afterwards, because it really does just reiterate all of the things that Jane and I are talking about, but give some of those stats that we talked about as well. So, with all of this in mind, you've got an event that you're planning,
Yes,
haven't you?
yes, and we're going to have so much fun. Now we're going to do some exercise. So if you're an exercise phobic, don't worry, you can even be seated, but we're going to put on some fun music, we're going to have a little boogie, we're going to have fun, and it's to launch this new free health initiative. Dr Renee's coming along to talk about menopause and different things in menopause, so we got the specialist there. I'm going to be talking about my experience. Jo is coming along as well, and also the lovely Jane Lewis from Who's Fab.
You've seen the blogs,
Yeah.
Jane.
And also, so we're going to have like a sort of like menopause cafe afterwards. We're going to have a cuppa and we're going to have a chat, but we're going to have lots and lots of fun. And also, we've got some fab raffle prizes. And we're going to raise money for women in sport because they want to further research into menopause and physical activity. So it's going to help women in sport as well. So it's on Saturday the 21st of September. It's from 10 until 1. It is at the Dutch Hall, EC1D. You can find all of the details on our website, menoandme.com. That's menoandme.com. And is there anything else I need to say?
We want you to come along.
Please come.
It's going to be really informative because there'll be sessions. It won't just be us boogieing on a chair. There'll be sessions where we talk about all of the different aspects of menopause. Jane Lewis has said we'll talk about vaginal atrophy, which is a massive part of this, which we need to address as well. And pelvic floor exercises sometimes, if done properly, can help with that. So there's a massive role for exercise, but also you might have other questions about menopause, and this is a really brilliant forum where you can feel safe, that you can ask anything, and you can get expert advice from the different people that are there on their different areas. So well worth coming along, very reasonably priced.
It's just under £40, and with that we've got a lovely company that's going to give us a free juice. I'm going to have some lovely healthy snacks because I want you to feel, I want you to be empowered and have fun there. But it's also those questions that you've wanted to ask. So we're going to try and find, we've got Slido, which is an app. So you can download the app, and during the morning you can ask questions because a lot of women don't want to verbalise about talking about, their dryness in their vagina, or a lot of the questions women don't want to answer. They're really embarrassed. You and I, we talk about it all the time. I'm very vocal on social media, but I understand a lot of women are not. So it's those questions that you've really wanted to ask.
Okay, so end messages from both Jane and I. From my perspective as a doctor and someone who's passionate about menopause, as you already know, exercise is absolutely key in menopause because it answers so many of the symptom questions all the way through, from mental health, which I think is massive, and anxiety, to bone health, cardiac health and brain health, don't forget. Because we think there's a link now with menopause and Alzheimer's, and we know that exercise is one of the antidotes to developing Alzheimer's dementia. So not to be sniffed at and not to be brushed away because it's hard, but also not to be scared of it. That people like Jane can convince you that very small starts can grow great big acorn trees in terms of exercise. So do come along to Jane's event. I'm going to be there. I'm really looking forward to it. Jane Lewis is going to be there. We've got some great guests, little goodie bags, snacks. I think it's well worth the trip. But also, I think it will be a great way for you to find out how you can incorporate simple exercise that works for you, because everybody's different, as we said earlier. Not everybody wants to run, not everybody wants to do aerobics. I did Zumba once. It was the worst hour in my life.
Oh, me too. Yeah, my knees.
Awful. But many people love it. So it's about finding what's right for you, and that's what we're going to help you do on the day. And at the same time, we'll be helping women in sport, which is really important.
And if you're not convinced, I want you to have a look at this TED talk that's on YouTube. This neuroscientist called Dr. Wendy Suzuki, and her TED talk is, I want to exercise after this TED talk. It's brilliant. It all talks about brain function and how she actually looked back and did some research and why she had to apply for grants to do different things, and she had to do it every year. And she said, this year, I really enjoyed it. What difference was it in my year? And she started exercising. But there was a reason why she started, and it's such an amazing TED talk. Dr. Wendy Suzuki.
Okay, so go to Jane's website, Meno and Me, MENOANDME.com, and the link to the event on the 21st September is there, and you can book tickets now, but there aren't that many. It's not a massive event, so you need to get in so that you get a ticket. And we'll see you there on the 21st of September. I'll put some links, as always, afterwards to the TED Talk, to my cycling and exercise in menopause, and anything else that Jane thinks will be useful for you. And hopefully we'll see you there. Ask any questions you want to in the vlog afterwards, as always, and either myself or Jane will answer them via me, obviously, because that's what we have to do.
Thank you.
Happy?
Yeah, really happy.
Everything covered.
Brilliant.
Lovely. Thanks for watching, as always, and I'll see you next time.